On the heels of the deadliest year yet amid the drug overdose crisis, a San Francisco supervisor is calling for more data on where people who are using and dying from illicit street drugs are coming from.
So we know anecdotally that there are people who come here from out of town, and often over the years I've seen it play out where there's debates about whether or to what extent San Francisco is a destination city for drug tourism.
Supervisor Matt Dorsey sending this letter to the city's controller's office, requesting it compile home address histories of people arrested for drug use and those who have died of an overdose.
So I wanted to work with the controller to identify a methodology. These numbers are not unknowable.
And once a methodology is established, the supervisor would like to see an annual report, which would also include data on where people are from who are receiving general assistance benefits from the city.
We owe to our taxpayers to make sure that the services we provide as part of a social safety net that's worthy of being the city of St. Francis is something that is for residents of the city of St. Francis. We can't be the social safety net for the Western United States.
The idea being that an annual report will help policymakers make more informed decisions addressing the drug overdose crisis.
And we have to have a clear-eyed view of what we're incentivizing and what we may need to change in terms of public policy. But before we do that, we should have a complete report.
But not everyone agrees with the supervisor's approach.
Focusing on energy on pointing a finger as opposed to like fixing a problem, it's just not effective.
Lydia Branston is the executive director of the Gubbio Project, a nonprofit providing services to people on the streets.
We're now going to ask for people to research, where do these people come from? For what purpose? What's the end game here? My question is, like, how do we, as a city, approach a crisis that is nationwide?
Approaches, she says, like more easily accessible treatment and safe consumption sites.
I would ask for our city politicians to focus on the fact that 806 people died on the street of overdose that could have been prevented, instead of focusing on where they came from.
In the meantime, Supervisor Dorsey says gathering the data is just one tool in battling the crisis.
Now, the supervisor says he's quite confident the city controller will take on this task. But again, he's also clear that collecting this data is just the first step and that he's not sure what policy changes would follow, if any. Larry and Kristen.
Sarah, thank you.